So the Health Department in Limpopo has launched a year-long mental health care training program. These sessions are aimed at orientating all mental health care practitioners, and that includes medical officers and medical interns, as well as some community service doctors. The department says this will reduce legal claims instituted as a result of a lack of skills and in the mental health care services. Let's make sense of it all for you now. Bring in the Limpopo Health MEC, Dr. Phophi Ramathuba, as well as the President of the Pan-African Psychology Union, Dr. Saths. To both our guests, thanks very much indeed for your time. It's great to have you for this incredibly important discussion. MEC, if I can begin with you, you've been quoted as saying that the time to treat mental health care with the same emergencies we do when confronted with other medical conditions is now. Does that suggest that perhaps you feel that there wasn't much priority given to mental health care until this point?
Yes, morning to all your viewers out there. And indeed, it's a fact that even mental health practitioners ourselves, we have not been treating medical emergencies the same as we would treat mental health care emergencies. Let me give a simple example so that your viewers out there can understand what I mean. When you have someone who's showing signs of withdrawal, depression, somebody's not sleeping well, try to reach out to all of us. We've seen it on social media. Very few of us act with the agency when you see someone with signs of asthmatic attack or some signs of cardiac arrest or somebody who's involved in an accident. We run around, we get all the ambulance, our casualty staff gets alert. But forgetting that in both scenarios, if you don't act with the emergency that both situation deserves, the results are the same as death. When we see somebody showing signs of mental illness and we do not act, we have seen people committing suicide. And we keep on saying, had we listened, we could have done something to have averted that. So that's why I'm saying, looking at what the COVID-19 pandemic has done in our community and the pressure that it has put in the society, and it's a high time now that we need to prioritize mental health care, and the energy that we use to fight COVID-19 pandemic, it should be used now towards fighting mental health. And because if we do that, we'll be able to defeat mortality rate, which is increasing as a result of mental health care illnesses.
Yeah. From what I understand, these workshops, MEC, that you're going to be running will be fortnightly and take place between 5 and 7 p.m. So that's 2 hours essentially. You'll know better than I do that, of course, there's a whole lot to discuss. I mean, this issue is quite vast. So help us, I guess, better understand the reasoning behind the kind of time limitation you've given for yourself here, for lack of a better term.
We're looking at the fact that here we have got professionals who are very scarce and who are currently working in their different facilities, our psychiatric nurses at the primary health care facilities. So when you look at the timing, between 17 hours and 19, that's the time when it's not too hectic in our institution. And the fact that we'll be doing them virtually, we look at the geographic spread of our province, and also COVID-19 has given us an opportunity to learn how to reach out to everybody through virtual. So we will be conducting those 2 hours, and the topics are clear out there. We have looked at as the most common mental health care conditions that are there. Just to give you an example, we already have started with basic admission procedures and the clinical assessment of in an emergency setting of a mental health care user. And we look at how do you manage an aggressive mental health care. There's an approach on schizophrenic, bipolar, and many other conditions, HIV, AIDS, and mental health issues, suicidal patients, and alcohol disorder, opioid addictions, and other cannabis. So all those topics that are very common when we did a burden of disease analysis with regard to mental health in our province. So we will be able to cover almost all the topics because it's a year-long program. But also at the same time, tomorrow we will be launching another parallel program. This one will be focusing on the community themselves. We will be at Market Tribal Authority, where in partnership with the House of Traditional Leaders and with the churches in the province, we will be having communities invited in different districts and sub-districts and municipalities, where we are going to have dialogues and have our own experts. We will be having our clinical psychologists, our psychiatrists there, social workers, together dealing with common mental health issues in our communities, dealing with stigmas. We're looking at issues of bullying of kids at school. These are mental health issues.
MEC, I've got you. Let me try. Apologies for interrupting you there. Yeah, I got the sentiment. I just want to make sure we give time to Dr. Cooper, who's also part of our discussion. Doc, thanks for your making time. I mean, typically, we often ask ourselves whether or not these kind of initiatives, which are obviously welcomed, have the right approach. From what you've heard already, is, the MEC, with all the great intentions that she has, essentially approaching this the way that it should, given the line of work that you've been engaged in?
Well, look, I think this is a seriously important issue. I think the MEC has looked at the factors that present in the various clinics and other health facilities that she's responsible for. She's catalogued those. I think that this is an excellent start. Research that is incontrovertible tells us that at least half of the people who present in doctors' rooms, in other facilities, have an underlying psychological or mental health problem. And depression, the World Health Organization has flagged for the last few decades now. It is very serious. We've seen the effects of COVID, which the MEC has pointed out. And I think what's important is that the frontline healthcare workers themselves need to be engaged for what they confront, because they've confronted very serious issues. Just like, for instance, frontline journalists, members of the police, and so on. These are all frontline people who've been terribly impacted, particularly during COVID, and mental health has been, and the MEC is very right, it's been hidden, it's a Cinderella, there's stigma associated with it, and I can safely say that from the viewpoint of our major affiliate, the Psychological Society of South Africa, the society and various higher education institutions that I know and I'm personally involved in will be able to back up the programs that the MEC is intending to roll out. And to that end, we stand committed to providing our expertise, not merely at a theoretical level, but at an intervention level.
Right.
This is a great start, and we will do everything within our power to ensure that whatever is piloted is successful and rolled out throughout the country. Heaven knows, we've seen incidents like violence, like the anger, like the racism, like the issues that confront our kids who have not been socialized ordinarily in our last 2 years. And they need to be dealt with as well. How parents deal with going back to school. There's a multitude of issues, and I'm pretty certain that the Psychological Society of South Africa, the Pan-African Psychology Union, and all our other supporters and members out there will be able to underpin this pilot to make it the success it deserves to be.
You speak about multiple issues, Dr. Cooper. One of them is that, ironically, the people who are sort of tasked with ensuring that there is a good level of mental health in society themselves often struggle with these issues in silence. How do we address that issue through a workshop like this, speaking about mental health challenges within health itself? Because unless these practitioners are able to deal with these issues, how are they ever going to be able to get any handle over the crisis in society?
Well, what we've done, and I can speak very specifically of the Psychological Society of South Africa, we've done a variety of online engagements with our own members and other health professionals. We even, in April 2020, offered the president to do some frontline intervention. Unfortunately, with all the other stuff that went on, this got lost. Perhaps we should have said we're going to charge 20 million. We offered to do it free. Now, here, the problem is that we know the people dealing with crises, frontline health workers, emergency room people, and others in the caring professions, including teachers, confront very, very serious issues because COVID has unearthed the demons, if you like, amongst us, and everything is free-floating out there. So we have the capacity, we have the education and training to be able to help identify burnout, very importantly, and depression. Depression has impacted all of us. None of us can say we weren't depressed during the last 2 years in some form. Maybe not clinical depression, but certainly the hopelessness is out there, and increasingly the helplessness from the majority of our people who are salary and otherwise compromised.
Absolutely. Well, the sentiment I'm getting is that it's a good start. Hopefully we'll be able to see it through and get to the desired outcomes. For now, let me thank you both for your time. We're never going to get through all the issues, but being able to highlight it hopefully is a good place to begin. The Health MEC in Limpopo, Dr. Phophi Ramathuba, also joining us there, Dr. Saths, who is the president of the Pan-African Psychology Union. Thanks once again.